So our clinic is made up of 16 exam rooms, and then we have one procedure room. We do a variety of procedures there, minor surgical procedures, cryotherapy, various OB things. I've done a colposcopy there. We can learn vasectomies, things like that. Also in the clinic, we have a variety of support staff. We have our own in-house laboratory. We have an x-ray technician that shoot our own films. We have an in-house pharmacy, a social worker, and somebody who helps us just with patient care in general. We also do some specialty clinics. We have an infectious disease clinic as well as a diabetes clinic, and those are staffed by the respecting specialists, so those are good experiences. We also have a resident office space that we use to just dictate and write our notes at the end of the day. We have a library downstairs where we can do some reading and also work on your notes and a little more privacy. And various other resources like that are available.
Our patient population is actually really diverse. You get some cool stuff, like really challenging patients with multiple comorbidities. Our clinic is pretty darn busy. We also have like the community closet and the food pantry, which is really cool and a great resource for a lot of our families. Getting to have our patients show up for clinic, get labs prior. We have the results usually before they get roomed, which is really, really nice, especially for continuity. Some of our patients have difficulty with transportation, so that's a really important piece to have those labs here and then be able to talk about it during the appointment.
I feel like the procedures in the clinic, we definitely have access to learning and getting better at several procedures. A lot of the times when we have a continuity patient for OB, we will follow that pediatric patient, the new pediatric patient, right? And then we will do the circumcision while they're in the hospital just before discharge. I've done that several times. And it's nice to be able to talk to the parents, talk them through it in the hospital, do the procedure on the patient, and then follow up with them in clinic.
The kind of layout that we have is we are in teams. I believe we have 4 different teams kind of split up into residents each level, as well as then you have a team nurse. Some teams I believe have 2 as well. And you get, as you are in the clinic with your nurse, you get to work with them. I would say most of the time as you kind of go into second year and third year. They kind of get to know who you are, you get to know who they are, and clinic can go and flow pretty well.
I think another thing was the fact that they did have an OB program, which is appealing to me. I know that a lot of programs struggle with that, and so the fact that there were opportunities to work hard and learn how to do OB, I was pretty excited about that too.